Hello, everyone. I'm Julie Birkenmaier from St. Louis University School of Social Work, and I'm here to present a project today on behalf of myself and two other members of our author and presentation team. I'm also presenting today is Jin Huang, who is the Irving Lewis Horowitz Professor in Social Policy at Washington University in St. Louis, and Yingying Zhang, who was a Ph.D. student on the project and now is an assistant professor at University of Jinan in China. And our presentation today is comprehensive measurement of individual financial access, development, validation, and standardized scoring using an item response theory. So we'll get started. The presentation today is divided into 6 parts. The first part provides the foundation, the background, the theory, the conceptualization of the project. Part 2 describes our, and in part 3, we'll talk about item response theory analysis, creating a standardized scoring for the scale. Part 4, we'll talk about practice applications and provide some case scenarios. Part 5, some implications of the project, and we'll conclude in part 6. Okay, so the first part, again, is the background and foundation, which is developing the case for comprehensive financial access measurement. So financial access is a critical component of both financial capability and financial well-being. And prior empirical research has shown that financial access is actually more important than financial knowledge alone for financial capability and financial well-being. Yet in our work, we have found that the current measurement approaches are really not adequate. And the problems are severalfold. First, there's oftentimes a narrow focus on basic financial product ownership. There's a lack of standardization of how this concept is measured across studies. And to our knowledge, there has never been a valid, comprehensive scale to measure financial access. In contrast, there are a lot of scales that measure financial literacy, financial skills, financial behavior, but there is not a scale that measures access at the individual or household level. And the need for a multidimensional validated measurement tool, we think is important for the field that includes financial product availability, service availability, the practices of institutions that deliver these products and services, the capabilities that individuals have to engage and really work with these products, and then also the outcomes. There are several concepts that are similar and overlap some, but that have a distinct, that are distinct from financial access. And the one that comes up quite a bit is the concept of financial inclusion. And financial inclusion is really a concept that's looking at population level measurement. And we have here on the slide 2 example studies of the measurement of financial inclusion. And 2 different studies here. You can see that it's measured in terms of ownership and usage of financial products and services, various products and services. Access in terms of ATM and branch density in communities and across societies, barriers, and certainly access as well, looking at how, what the proportion of people that own accounts and that have debit cards, et cetera. So financial inclusion is a distinct yet related concept to financial access. 2 guiding theories, perspectives really helped us with this project getting started. The first one is the ecological framework by Bronfenbrenner that describes how financial well-being can develop through environmental interaction, that individual outcomes in terms of capability and well-being cannot be understood without examining the systems in which people are operating. And then financial capability framework, which was developed by our colleague Margaret Sheridan, built on the capability theory developed by Armada Sen and Martha Nussbaum, distinguishes between functionings, which is actual achievement, and capabilities, which are people's real opportunities. And this framework captures both the environmental opportunities and the individual capabilities. So the idea is that in terms of our work, access enables capability with people's finances. There are other concepts that are closely related but are also distinct that we want to describe here to kind of separate access from these related concepts. And the first is financial literacy, that is financial knowledge and financial skills. Financial capability, which is one's ability to act and opportunity to act. So what skills and knowledge people have and their available appropriate products and services. The third is financial self-efficacy, which is one's confidence in managing financial affairs. And the fourth is financial well-being, which is a subjective measure of feeling financially secure and having choices. And financial access, again, is a distinct concept from that. And we wanted to, in this project, develop a scale and validate a scale that would differentiate this concept. So this slide shows the steps that we've taken to develop the scale. And briefly, on the left-hand side, you can see there were 3 phases. The first one was item development, the second, scale development, and the third, scale evaluation. We're going to briefly discuss item development, go into some detail over the scale development, and talk more in depth about the scale evaluation steps. But you can see here that this was a long project. It was about a 3-year project. So in the first step, the item development, we identified domains going through a systematic literature review. And that literature review has been published, where we went through relevant conceptual and empirical literature related to financial access to really learn more about how scholars were discussing the concept, what domains create this concept. And the first one we found, of course, is products and services, right? So bank accounts, retirement accounts, credit, insurance, non-retirement investments, and the like. The second domain we found was institutional practices. So whether institutions are fair, whether they provide non-discriminatory services, whether people feel like they're treated well when they're working with those institutions, whether they encounter any barriers to using those services and using those products. The third domain is individual abilities, that is one's intrinsic qualities for product interaction. So this would include maybe financial knowledge and financial skills, financial literacy, etc. The fourth domain, individual actions, is a little bit different. It's one's choice to use, comfort, and satisfaction over time. It's essentially the agency that people are bringing to that interaction with financial products and services. So we performed an exploratory factor analysis to examine these domains, and the results suggested an overlap between domain 3 and domain 4. So combining those two to create just one individual domain. So building on that exploratory factor analysis, we created the first scale, the first iteration of the scale, which we called an individual financial access scale. And we conducted a national data collection process, created a data set, and we then are working toward these next steps. This is creating, using confirmatory factor analysis to validate the factor structure and examine the reliability and validity of the scale. And then in the second phase, using item response theory analysis to develop a standardized scoring method. And then, of course, moving then into discussing how the scale has practical applications for research and practice, and also has policy implications as well. So now I'm going to stop sharing and turn it over to my co-presenter today, Jin Huang.
Okay, excellent. Thank you, Julie. Moving into part 2, we shift from the conceptual idea of a measurement model of financial access to the empirical how. My goal today is to walk you through the validation process that lead to the creation of individual financial access scale, or IFAS. We aren't just looking at whether someone has a bank account. As Julie mentioned, we have multiple domains, and we are measuring the entire ecosystem of financial opportunity. In this final phase of validation, and we utilize two approaches. First, a confirmatory factor analysis to log in the factor structure, and then followed by item response theory to ensure we had a precise, accurate instrument for standardized scoring. Okay, to validate the scale, we fill a national survey of 4,094 US adults through Quadrix. And our sampling strategy was intentional, matching US SAMHSA quotas to ensure that the data is similar to the American public. On the next slide, you will see the diversity of our sample respondents. And to make sure of the data quality, we embedded multiple data quality controls in the survey data collection process. And I want to emphasize that our survey also includes a group of validated household finance related measures, like a CFPB's financial well-being scale, as well as measures of financial attitudes, behaviors, knowledge, and skills. By including these additional concepts and scales, we can statistically demonstrate the financial access is a distinct concept to support the measurement of convergent validity of financial access scale. Okay, on this slide, you can see that representative probably it's not the most accurate term here, but here the diversity of the sample allows us to test for systematic barriers across different life stages, different populations, and communities. Okay, innovation in our methodology is our four-level measurements of product access by asking three questions. Traditional surveys treat bank accounts or financial product ownership as a binary yes or no question. And we went deeper by applying these three question sequence for every financial product we ask. Do you own it? If not, is it available? And if you do own it, does it actually meet your needs? So this created a four-level variables, as you can see on the right side of this slide. And the final level, it's optimal access, meaning the product is both owned and suitable. And this allows us to capture the difference between a product that's technically available, but practically unsuitable, or even bad product for a specific family needs. Okay, here you can see that moving into the broader environment, like Julie mentioned previously, we look into three additional domains for financial access. And to give you a sense of the actual items we use, for example, for domain 2, institutional practice, we measure the provider side with statements like financial services companies treat people equally and fairly. And for domain 3, individual abilities, the measures that measures personal readiness. Item in these domains, something like I'm aware of the products and services from financial service companies. And domain 4, individual actions. This looks specific actions such as I have and use any needed technology to access financial products and services. Now, as Julie mentioned, eventually in the final measurement, in the final scale, we combine these two domains, the domain 3 and domain 4 together. Okay, here you can see the analysis strategy for our final phase of validation. Our initial exploratory factor analysis in the last phase identified a 14-item factor structure, 14 items. However, to ensure the scale remained grounded in the core products we often track, we added 5 basic products into these 14-item survey measures. In total, we have 19 items included in the second survey in this phase. So these 5 additional basic products include checking accounts, savings account, mobile banking, credit cards, and transfer applications. So that way, we have a comprehensive pool of 19 measurement items here. Now, in our confirmatory factor analysis here, as you can see on the right side of on this slide, we use the model fit criteria listed here. And the model fit tells us how well our conceptual measurement theory matches the reality of the data we collect here, okay? And then for composite reliability, which we want the composite reliability is greater than 0.7 to ensure internal consistency of this scale. And for average variance extracted, which should be greater than 0.50 to ensure convergent validity, okay? And we test these models using both ordinal and binary measures. And the results for these two types of measures are consistent. And the descriptive findings on these items tell a good story here. Basic banking service, basic financial products have a relatively high ownership rate, about 88% to 89%. However, wealth building products show massive gaps here. Only 28% for CDs and 37% for investment products. So these measures, especially in the domain 1 about financial products and service here, these may create a ceiling effect for basic products. So they no longer distinguish between levels of financial access because the ownership rate is relatively high. And this is why in our final scale, our final measurement scale prioritize those advanced products. When we show our results later on, you will see that we really prioritize those advanced wealth building products as the true discriminators of financial access. Okay, and now let's look at the 5 confirmatory factor analysis model specifications that led us to the final scaling. And in the model 1, we use the baseline model, including 14 measurement items we generated from our last phase, and also include 4 domain. We also include 4 domain structure. It has accessible fit, but show a very high correlation, 0.93, very high correlation between individual ability and individual action. Suggesting they were not distinct. These 2 domains were not distinct. So that's why we combine these 2 domains together, like Julie mentioned previously. So in model 2, we address this by combining domain 3 and domain 4 into one specific domain, individual ability and actions, okay? And then domain 3 testing a second order structure, asking if we have an overarching factor of financial access, explaining everything. So it revealed that in model 3, it revealed that institutional practice load most on this second level factor. The factor loading is 0.94, much higher than product ownership, 0.50. So proving external environment, it's a more powerful predictor of access than actual account ownership. Okay, So the model 4 is our the model with only 10 items. By removing 4 items with relatively lower factor loadings, like financial counseling, we achieve the best model fit in the model 4. And model 5 test all 19 item pool, all 19 items we have in this round of data collection. Well, the model still worked. It was statistically with more noises and less efficient compared to model 4 with refined 10 item models. Okay, so these 5 different model specifications and comparison led us to 2 versions of factor structure and model specification. One is the 14-item comprehensive version for research, and the other one is 10-item version for clinical or community intake. Both versions are grounded in the same robust factor structure and very good model fit indices and strong internal consistency and convergent reliability. Okay, so now, on this slide, you can see all items. You can see the complete item question statements for our final measures here. For the domain 1 financial products, we focus on 3 wealth building products. And for domain 2, we have 2 items in terms of fair treatment and welcoming surroundings. And for domain 3, we have 5 items about awareness, comfort, understanding, satisfaction, and affordability. So those 10 items are the measure we created for clinical and community use, and you can add 4 more items for research purpose. And here you can see the reliability measure and the validity measure for these 2 versions. Okay, next, we are going to move on to the final analysis of item response theory analysis. If confirmatory factor analysis, it's about the whole structure of this measure. IRT, item response theory, it's about the strength of each and specific individual item. Traditional classical test theory assumes that every item is created equal, and IRT allows us to know the strength and weight of these different items. So move away from a simple sum of the point toward it a weighted score. So IRT create a weighted score for financial access. Okay, so to understand our results, we have to look at 2 parameters that define each item in this financial access scale: difficulty and discrimination. So difficulty, first of all, let's talk about difficulty. Think of this difficulty as hurdled. It identifies where on the ladder of financial access an item is located. So difficulty tells us the rank of each measurement item along this sequence of the financial access. Okay? And then about discrimination, you can think about this discrimination as the magnifying power or the sharpness of this item. So it tells us how well the specific item distinguish between 2 sample respondents who are slightly different, at slightly different levels of access. So a high discrimination item is a high resolution item. A low discrimination item is kind of blurry. So we really want to have low difficulty and high discrimination item to measure financial access. And here you can see the analysis approach, and we are also using this same sample data for us to analysis financial analysis. Now, okay, you can take a look of these ICC curves for the first domains we have here. You might not be able to see read the notes here, but these 4 curves show you the difficulty and discrimination of each financial products and services we included in our measurement. The first one on the left side here, the first one, the pink one here, it's the CDs. So along these axes on the X, you can see the rank or the difficulty level of these 4 items for financial access. The item on the left side, it's going to have a low difficulty level. So as you can see here, the lowest difficulty level of financial product to measure financial access, it's CDs. So which means most people can clear this hurdle to answer the question, okay? And then the slope of these 4 curves shows the discrimination. When we have steep slope, it's which means this measure has a higher discrimination to measure financial access. Now here, as you can see here, compared to the red curve, which is about financial counseling, the pink one on financial on CDs has a much steeper slope compared to financial counseling. So it's a higher solution, higher resolution to measure financial access. So these ICC curves really tell us which item is a better item to measure financial access here. Or here you can see the parameters of discrimination parameters and the difficulty parameters. The number one here is CDs. As you can see here, the CDs has a negative difficulty parameter, which means it's a less difficult item for participants to answer the question. But on the other hand, at the same time, CD has a higher discrimination parameter, 0.89, much higher than all other items in our 14 item scales. So it has a much higher discrimination parameter to help us to understand the measure of financial access. So based on these rankings of discrimination parameter and difficulty parameters here, we can see that among 14 items, CDs actually is the best financial access measure for us to understand people's financial access situation. Okay, so these slides summarize our major results from item response theory. The most accessible item, as I mentioned, is CDs or savings bond. It has lowest difficulty parameter and highest discrimination parameter. Okay, and the most challenging item here, in fact, it's the awareness of the product. So it's really difficult to achieve a full awareness of the financial products available to people. So the difficulty level is 1.4 here, and it indicates to some extent if we try to use financial education or individual counseling approach to help people improve their awareness, improve their financial information and behavior, to some extent, it's going to be very difficult to achieve through the intervention approach. Okay, now based on the item response theory, we are able to create the final standardized scaling protocols for these 10 item or 14 item measures of financial access. So on this slide, you can see our scoring table for 10 items, right? So in terms of financial product domains, we include 3 binary financial product measures. And if participants or if people identify one ownership, they are going, among these three products, they are going to get 3.5 scores. And if they have two items, two financial products ownership, that's going to increase their score to 6.4 within this domain. And the final score here is 10. So you can see that we have 10 across all three domains. So in together, the total score of these 10 item measure is going to be 30. And same thing here. If we use the 14 items, eventually we are able to get a total score of 30 to measure people's financial access. So with this scoring table, our researchers and practitioners and community organizations can use these tables to measure individual financial access.
Well, thank you, Jin, so much for that highly detailed and very informative part 2 and part 3 explanation of the development of the scale. I'm going to, in this part 4, talk about practice implications, how these two versions of the scale may be useful in human services and in social services. So what we have here is a couple of, the next few slides, a couple of scenarios where this may be useful and explain how it could be useful, could be somewhat enlightening. The first one here is a scenario where you have an individual you're working with who has recently exited homelessness, and they're living in a transitional housing program. And they don't have a bank account. They have very poor credit because in the past they had, medical debt. They are employed part-time, and their big goal is saving for a security deposit for permanent independent housing. And so using the IFAS scale, you could see where for the products domain, they would score a 0. They currently don't own any products at all. For the institutional domain, they may get a score of 4.9. They perhaps have been treated fairly in the past, but they don't perceive financial institutions as being particularly welcoming to people in their kind of situation. And in terms of their individual ability and action domain, they may have scored a 3.6, where they have low awareness of the products and services available to them, and they're not very comfortable with them. So their overall score would be 8.5 out of 30, a possible score of 30, as Jin was mentioning. And so working with that individual, you could perhaps then target an intervention to where the need is highest on these domains. So in the first domain, the products, clearly there could be some intervention done in terms of helping the individual become banked with maybe a second chance account at a CDFI or a credit union. In terms of the institution domain, it may be possible as part of that process of becoming banked to connect with someone at the bank who's willing to serve in maybe a liaison role to help that person become more comfortable. It could even be a teller or somebody else at the bank. And in terms of the individual ability or action, this person might be a great candidate for financial coaching, and particularly focusing on saving strategy and become more comfortable working with some of those basic products. Another scenario, again, using the 10-item scale, could be working with youth coming out of foster care, where the person might have their first job. Maybe they have a little bit of money from a signing bonus where they're able to potentially make a deposit in an account, but they don't have any banking history. They don't have any credit. They don't even have any family financial guidance, right? But they have a motivation. So in taking the scale, maybe they scored a 0, right? Because they don't have any products or services, yet they have a 4.9 score, a neutral perception of banks. They haven't had a lot of experience with them, but they are not really certain about, how they might interact with institutions. And then they score maybe a 3.6 there for individual ability or action. They're aware, they're motivated, but they're just inexperienced. So they receive an 8.5 also out of 30. And again, just targeting those domains in terms of an intervention, you might help them open a product, a first account product, and help them get maybe started with a credit card through an institution that has a very low credit, they're not able to charge very much on it with a low credit limit. In terms of the institution, you're looking for an institution that is very youth friendly, that can work well with younger people that don't have that much experience with institutions. Again, maybe a bank that has a reputation for that, or a credit union. And then in terms of ability, this person might be suitable for really comprehensive financial education, and starting kind of from the beginning with budgeting and long-term planning, and setting out a good path for being engaged with institutions as they move into their adulthood. So I've been talking about individual applications, but we think also that the scale could have organizational applications. So for organizations, using this on a broader scale, maybe using it with a wide variety of clients, it might help identify community-wide access gaps. And again, being able to drill down into those specific domains may tell you, specifically what kind of gaps there may be in a community or among a population of your clients. It may also help document the need for funders. Maybe organizations are trying to provide financial coaching or financial counseling, or even working on the institutional engagement part of client finances. And using the IFAS scale can help build an evidence base for what kinds of needs for potential grants and for potential funders. It may also help in using it pre and post, intervention to help show program effectiveness and prioritize different parts of a service delivery program. And then it also, of course, may be helpful for advocacy, right? And it may help both with funders and with advocates demonstrate barriers to financial products and services, so that if organizations are working with financial institutions to develop different kinds of products, this may provide some evidence to help make that case. It could also support policy recommendations around consumer-friendly banking, and particularly that institutional aspect that Jin was talking about earlier that really drives a lot of the effects here. It may also help address systemic access issues and support community-wide capability efforts. So we think it has organizational and advocacy implications. And then in terms of moving into this next part with discussion, what we're hoping is, with the development of this valid and reliable scale, to begin to shift the paradigm of what financial access means and how it's measured beyond simple ownership, right? Certainly the scale captures the ownerships of both basic and higher level financial products and services, but it also captures institutional factors and individual capabilities, and not just ownership. We also hope that the interest in the scale would be even larger, because there are two different versions of this. Perhaps the 10-item version would be really helpful for working with individuals and families, and then the 14-item may be, although longer, better for comprehensive program evaluation and some of those larger community-wide possibilities that I mentioned earlier. We certainly want to highlight the idea that the scale has robust psychometrics, as Jin was talking about earlier. And certainly we feel like the standardized scoring as a result of the IRT analysis will really help make meaningful comparisons across time and across populations. For practitioners, as I mentioned, there are those two different versions. The 10-item may be more helpful for routine use, and the 14-item more helpful for comprehensive use. And we certainly hope that we can work with the practice community to promote the use of the scale towards some of these uses. In terms of research, as I mentioned, what we're hoping is that this would enable the consistent comparisons across studies. So what financial access is measuring in one study could be the same as in these different studies, and be able to look at trends over time and enable more longitudinal intervention studies and more precise examination of access outcomes relationships in other kinds of studies. We also want to stress the idea that this could document disparity and discrimination in institutions and help move them toward better customer service. And then also, certainly, we hope that it's also useful for policy research as well to show policy effectiveness. In terms of the future research uses of the scale, we certainly have a good to-do list for looking at the scale in terms of testing, measurement, and variance across populations, to use it longitudinally for longitudinal validation of the scale, retest reliability, predictive validity studies. And then we're also hoping at some point to move into international applications of the scale as well. We're thinking also about the idea that the scale may have regulatory applications as well, that over time, with the collection of data about the 3 different domains, that this may become of interest and usefulness to regulatory agencies that are in discussion with financial institutions about their CRA assessment and compliance, to be able to identify underserved markets in more than just perhaps the credit markets, but also in terms of the institutional domain, and as well as the individual capability. Maybe there are aspects of the domain, the use of the scale in terms of looking at domains that might be useful for in the discussions between regulators and financial institutions. We also do want to mention that the Treasury Department in 2024 issued a National Financial Inclusion Strategy, which is very impressive. It does not yet have a evaluation component, and we're wondering whether the scale may have implications for the measurement of financial inclusion across the population of the United States. So that's something that we want to take a look at in the future. And in terms of policy design, we also think that this might be helpful for being able to prioritize underserved investments in communities, designing targeted access programs, right? Being able to really we better understand what financial access is and the multidimensional nature of it. You might be able to better target financial access programming across communities and be able to better determine at a policy level whether communities actually need, perhaps more bricks and mortar institutions in their community, or institution may need improved practices and customer service ability or capability programs. So we want to mention, of course, as all research studies do, this one has its limitations. As Jin mentioned, we used online convenience panel in our data collection across 2 different surveys, which may limit some generalizability of our findings. Social desirability may affect the reports of financial behaviors and perceptions that we collected in our surveys. The project obviously relied on cross-sectional data collection, which prevents causal inference. And of course, as we also have been mentioning, longitudinal studies are really needed for retest reliability and sensitivity to changes. So as we conclude our presentation, we definitely want to thank the National Endowment for Financial Education. You all have been very supportive. You financially supported us throughout the process and supported us as well in programmatic ways. So we want to thank you very much for your long-term support. And these are the references that we've used. Thank you so much again for your attention. We appreciate it.